Hi, good evening, and how are you doing? Welcome to another session of Ask the Doctors. Today's program is going to be a question and answer session. How are you, and how has been your day? Now, if you're watching for the first time, my name is Dr. Frederick Unugohai. I'm a medical doctor, and we have this program every Sunday by 8 p.m. to 9 p.m. West African time. On today's program, we will be having a question and answer session. My co host is Dr. Israel, and he'll be joining us very soon. Can you hear me? We are live on Facebook and we are live on YouTube. I think last week we were live on X as well, but no much time. Let's just face our live session here. So if you can hear me, I want you to tell me, where are you watching me from? How are you now? How are you day? What's up with you? If you have any questions, please drop them in the comments section. And what again? Let me see if let me see. I want to check my audio. I want to check my audio. Let's check. Okay, oh, I'm coming. I want to check. Okay. I want to check my audio. Okay, the audio is fine. If you have any questions, drop them in the comment section. But I beg you, we would not treat you here. Neither would we prescribe medications for you here. But if there's anything that is not clear to you, want me to explain, I will try my best. If you have a complaint, always beg you to go to the hospital and speak with your doctor. Is that okay? Uh-huh. I want to be sure that we are together. Let me see. I fit let me see. Okay. So ask me now quickly, because if you ask these questions after we have ended, you ask me question, I no go fit answer you. I can only answer you now when we are live. Let me see. Where are my YouTube people? Hello, good evening. Hello, ma. Good evening. How are you doing? Long time, ma. How far now? How was the wedding? Tell me. Okay. Good evening. Okay. So, yesterday was Valentine, and I know some people went out, had fun, you expressed love, you're welcome back. For some people, they can start counting their 9 months from now. You can start taking your folic acid from now on. Yes, good. Oh yeah, ask me. Come, I hope I'm not missing the questions here. Let me see. Dr. Israel will be joining us soon, and when he joins us, I'll bring him up. Okay. Do I have anybody on YouTube? Yeah, YouTube people. Oh yeah, look at the comment section on YouTube. Drop your comments there and give this live session a thumbs up. Ask me now. You know the problem? When you tell people to ask you, they don't go ask you. When you are done, or you are doing something else, or you are busy with your life, you're not here, and they ask me, they answer me, ask now, where are they live, why they see you, ask now. But if you know, ask, no problem. We can just gist. What do I want to tell you? Say, what do I want to tell? What do I want to tell you? What do I want to tell you? What do I want to tell you? Well, I really don't even have. Let me see. I'm good. The wedding was great. Thank you. You're welcome, ma. You're welcome. Yes. I hope it wasn't stressful. Okay. Where the people on YouTube? Oh yeah, just me. Let me see if I have a comment here. Can cold cause knee pain? Cold does not cause knee pain. Cold does not cause problem with your knee. Mm-mm. But if you have a problem with your knee, there are some kind of problems you can have. What me your name? Alaji Tijan. If there are some problems you can have with your knee, when the weather is very cold, it can trigger pain. It can make the pain worsen. But cold does not give you knee pain. Is that okay? Yes, we have somebody on YouTube. Wise Man Victory. Victory, how far now? Happy Sunday. Yes, I see you. I see you. Welcome. Oh, yeah, ask me your question quickly. So that I go fit answer you now before other people go come here now. They'll come, they ask, come back, I know they answer them. Maybe we're talking about high blood pressure. Somebody go come, they ask you questions about kidney or about ulcer. Now that we are having an open day, ask me anything now. If not, no time. Okay, very good. This is our topic for today. Vania, where are you watching me from? Vania Mwenga Ekunife. I like this name. Where are you from? Vania Mwenga Ekunife. Did I pronounce it well? I try. Oh yeah, gist me. Let me see. Which other comment do we have? Vincent, Oba Vincent. I greet you specially. Okay. So by the time people go start to ask me question, then I go to answer their question. But for now, what I want to tell you now. You know, some people know they take their health seriously until problem don't enter. From where? From Angola. I thought as much. Yeah. I thought as much. Good evening. I greet you specially, sir. Okay. What will be this? Let me see. Nobody gets to. Everybody, they look me. They look me now. They look me as they look you. I won't give you my phone number. I won't give you my phone number for you to start calling me online. I know they do them. So I'm making myself available now so that you can ask me anything. But people go say, Doctor, I beg, I call you. I beg, no vex. Yeah. Does daily masturbation cause problems for men? Does daily masturbation cause problems for men? Okay. I know they like talk about this one because these social media people, their head no day okay. If you just vex one day, flag your page because of what you talk. So let's use the word soapy. Is soapy good or bad? From a medical perspective, people they do soapy, and soapy gets some little good benefits and bad benefits. Good one in the sense that it will just help your body feel relaxed, full stop. Bad one, we say it can cause addiction. When we say every day of your life, every day you go to do soapy every day, it will affect you. It will affect you and your partner. It will affect your relationship, and if it cause you problem. From the medical perspective, soapy no get any like we go affect you like that, except for the addiction. Now that addiction, he can't give you problem, affect you. You feel enjoy yourself for that place. You feel affect your relationship. Some other people go tell you say spiritually, and this one do soapy, but here I'm not your pastor. You understand? This is not a church. If you're a young man, I will not encourage you to do soapy. Like I'm not going to say you do one because when you start, it go hard for you to wait in. It go hard for you to stop. They hear me so. I'm one of the follow good. Please, you have not answered my question. I'm not seeing your question. Oh yeah, ask me. Quick, ask your question. Ask. Is there any way I can show you a video because I don't know how to describe it to you? Show me video for what? I'm sorry, you can't. There is no way you can show me video. unless you are booking for a consultation. Other than that, there is no way, no vex. Yeah, no vex. Sorry. What can cause nerve pain in leg? Do you know wetin be nerve pain? Vania, you know wetin be nerve pain? What do you mean by nerve pain? You know I'm asking you. Some people go dey use some kind of words wey they don't know wetin e mean. So what do you mean by nerve pain? How you take know? Say na your nerve dey pain you. How do you know? How did you arrive at that point? How did you arrive at the conclusion? Say na nerve dey pain you. You know wetin be nerve? You know the nerve wey dey for your leg. You know the location of the nerve. So explain to me, huh? What can I do? My foot toes for shoe corn. Explain. If what you are talking about is all those corns on the toe, go hospital, they'll help you come out. It's not a big deal. They go help you come out. Celestine, they go help you come out. It's not a big deal, yeah? Yep. Good evening, sir. Mr. Tunji. Mr. Tunji, how are you? Good evening. I greet you specially. Okay. Make I see. Make I see. Now, only one person don't share this live session. Only one person I don't share this live session. So I'm going to answer only this person today. The rest of you will never share. I'm not going to answer you if you ask me question. Okay, Mute, Gladys, good evening, ma. Madam Stella, good evening. I'm watching from Delta State, Ugeli. Okay. How is Ugeli now? Alpha. Happy Sunday to you. I greet you. See, now only one person don't share this live session. If you ask me question, you never share. I no go answer you. Like, I no go answer you. Do me, I do for you. You do for me, I do for you. You don't do for me, I not do for you. Yes. Okay. Now only one person don't share. The rest of us, they look me. Good evening, sir. What can cause early ejaculation on a young guy of 27 years? Early ejaculation of a young guy doesn't man. Well, you see, the problem they say sometimes problem not day. Sometimes problem not day. Sometimes now the guy cause him. So if the 27-year-old guy, if he is stressed, if he cause him to ejaculate early, if the 27-year-old guy gets anxiety, performance anxiety, that is the moment the guy see Toto, yes, his body go they shake, he go release. I'm saying this so that you can understand. I don't want to use the real word. I don't want them to flag my page. So sometimes these young men, performance anxiety, they cause them. Tiredness, they cause them. Abuse of medication, they cause them. Small boys, because of woman, they go drink some kind of things because they want to impress a woman. And if it affect them, maybe say, if you can't make them, they'll come, they release early. By the time they don't take that substance, sometimes maybe the guy gets some kind of medical condition. But generally, for a young man, the first round, most times they short. The first round, they always they short. The first round. The second round, they longer than the first round. But when you say they ejaculate early, you they time them, you they count the time, you they put wristwatch, say, as I don't start to the make now, after like 30 minutes, I don't release. What do you mean by say you even ejaculate early? Because for most people, for most guys, they do well. Just that they want to sleep inside that place for a long time. Oh, you want to be there so that the woman go they praise you. No. Generally, you might be fine. Just that now your own psychology feel they work on you. Good evening. I'm watching you from Abuja, Maitama. Hey, Mr. Hamson Jack. How is Abuja now? I just say now big men did that my time out. Elephant prophets. I be elephant puppets. How far? Hey, Dr. Ishod is in the house. Yeah. Dr. Israel, good evening. How you doing?
I'm fine. Good evening. Nice, everybody. Happy Sunday.
Yeah, happy Sunday. Welcome back. You don't say why I see you. Thank God. We don't see you today. Yeah, so we did do question and answer session. So if you get any question for us tonight, you can ask and we'll try our best to respond, to clarify. But if you know so you're sick, you go need to go hospital because we know go fit treat you for here. This place is not for consultation. We have a question. It says, doctor, my wife is pregnant. We went for scan. The scan discovered twin, but separated. A show female be hidden. What does that mean? I don't understand. I don't understand this question. I beg. I beg. Send them again, No vex. You have not answered my question since, so we are not seeing your question now. Wise man, rephrase your question. We are not seeing your question. Your question is not appearing. So send it again and rephrase it. Good evening from Ibadan. I have a boil in my anus area. Can I say is a boil? Sometimes if the boy want to gather some water, it do pain me. I went to do test. Doctor couldn't able to know what it is. Make I allow Dr. Israel respond to you.
Well, I really don't know how I want to respond to the question because he said, boy in the anus, gather water. A boy, we don't be gather water for inside again. And when he gather water, it will become painful. You did a test. Doctor could not tell you what it is. Which doctor you go meet? And also, that boy where you dey talk, if na boy, because I know they see and what we know they see, we know they fit talk much about it. How it does it look like? So now still doctor, you need to go hospital, not be pharmacy doctor or chemist or lab doctor. No, go hospital, so that they go look the boy, whether na boy, whether not be boy, whether na swelling, whether na growth, whether na your anus dey even bulge out from there, make dem for know wetin e be. Yeah, because if you say boy gathering water, I don't know which type boy go take gather water sometimes, and gather water and sometimes, because we know that once the boy is a collection, it's always a collection. So that's why you need to see a doctor, make them for examine the part of that body where. When I'm missing the doctor, I know they say go to chemist or lab. I mean hospital. Yeah, I mean hospital. And make sure see they look and they see am. Not the one where you just say I get boy for the person will write drug for you. No, make it see am, make it look am. Because if you know you'll be boy, if it be something else. Dr. Fred.
Yeah, thank you very much, Dr. Israel, for that question. Okay, let me see. If you just come, you're welcome. Will take question and answer? So if you get any question, try ask quickly. Maybe try see whether we can answer you. And if we no read your question, send them again. Let's see. Good evening. I'm Jacob from Sierra Leone. What are the early signs of liver problem? Because I always feel pain on my left side where the liver normally dey. What are the early signs of liver problem? So I beg, make I respond quickly. Wetin you dey try do, Mr. Jacob Kanu Zachariah, is not okay. You dey try find out what na liver problem you get. What if no be liver problem you get? What if na something else? You're already trying to make diagnosis for yourself instead of make you go hospital, make them check you. Make them know where the pain they really come from, because you can have a liver problem and you feel not get any sign at the early stage. You feel not get any sign at all. It might just be something else, or if it be even be liver problem, where don't go far without you knowing. So when you sit at home and you get pain for one side, and they want us to tell you waiting be liver signs to know whether na liver be that, and then if not be that one, you go come they jump before you go come know if you don't cause severe problem. If this thing they pain you for that side, the thing you going to do now to see doctor, because early signs of liver problem you feel no get any sign. That is my answer to you, Dr. Israel. You want to answer this question, or you want to drop any comment on this?
Yeah, the first thing, wait, I want to talk for the comment is that first thing, in our short saying liver the pain, because where you say liver day, not be there liver day. Liver not there the left side of your abdomen. Liver is at the right hand side of your
left.
abdomen.
Yeah,
so not be your left hand side.
Now right.
Say left side. So
Yeah.
if na left hand side they pain you, not be liver problem
Okay, yeah.
you get to, you better go to the hospital so that they will find out waiting and feel they cause the pain at that your left side of your abdomen. Yeah. Mm-hmm.
Yeah. Thank you very much. Okay, share this video. Oh yeah, share. Make sure say you share, because now those we share we they respond to. Doctor, I have been watching you for long. You have not talked about autism in children or delays in talking, please. Stella, see, no vex. There are many things I have not spoken about. Plenty things. So many things, because we are busy, we are tired, and it gets some things where we go talk about, nobody go watch them. So many things there where we never talk about. And autism, they are among them. I never talk about them. Our people don't like to pay attention to some kind topics. And one of them, now this particular one, autism. So I would advise you, no vex. Try go YouTube. Many videos on autism they there where you go watch. But if you get any specific question on autism, you can ask us. But if you find videos, many day YouTube. The reason why I take my time, because our people, you get some topics where you go talk about, they no go watch your videos, go down and you go do poorly. And I'm taking my time to make videos where the general public can relate to. No vex. Good evening, doctor. My mother is currently sick and she urinates 4 times in every hour. Please, what could be the problem? Dr. Israel, you want to respond?
Okay, if your mama they piss like that, they piss urine frequency like that almost all the time, one of the things you need to find out the sugar level. Another thing now to find out whether the pain and when it piss. Or if the pain and if it say it gets some kind of urinary tract infection. So I don't mention 2 things. One, if it say sugar with the body in many well, 9 they make and they piss like that. 2, if it be say na urinary tract infection na e get na e cause am. 3, if it be say the bladder don old, the bladder no dey fit hold urine again, so any small time you wan go urinate, any small thing you wan go urinate, maybe because she himself don old. 4, if it be say e dey on medication, some medication dey wey dey make people dey piss. If e dey on that medication, e fit make am dey go dey urinate almost all the time. So medication fit be part of it. So the wetin I dey try tell you on this is to let you know, say there is no one major cause of frequent urination. Frequent urination are just symptom of some diseases, and some of them also conditions, and now some of them I don't already mention. So the best thing is, though, because the piss well, you need to carry and go hospital, make it all go before you come from peace, you can't get an admission in the. Yeah. If the kidney also don't they get problem, say the kidney one they collapse, one they go, person visit they urinate all the time. Then after some time, it go stop to the urinate, no urinate again. So with the best thing is for you to go hospital, where they ask all these questions when we go make them know which of the problem actually the person gets, where they make her they urinate more often. Whether na sugar, we go know. whether na urinary tract infection, we go know. Whether na medication, we go know. Whether na the kidney don dey go, we go also know. But dem have to ask some questions and do some investigation before they go fit finally know which and which dey really cause our own frequent urination. Dr. Fred.
Thank you very much. This person, two things. Number one, you dey frustrate me as well as you dey frustrate yourself. And I know they like this kind of thing. You dey drop comments online. This social media, their head get as e be. You dey drop comments. Your comments not dey show. We not dey see your comments. Instead of you to change your comments, if you write, you get word like the male manhood now. You get how you go write them, they go block your comments. Or the female area there. You get how you go write them, they go block your comments. So instead of you to keep doing the same thing, change the comments. Use another way to write them. Maybe we go see them. But if you continue like this, I go ignore you. We not to see your comments, especially Wise Man Victory on YouTube. Drop your comment, change them. We go read your comments. I'm giving you priority. I'm giving the YouTube people priority because now YouTube they even pay people past Facebook. But now Facebook people they ask pass. So YouTube guys, drop more comments. We go answer you. Yes. Good evening, doctor. Please, can lack of sex cause testicle tests? Hey, I don't understand. You understand that one?
No.
Okay, sometimes the boil will just burst with some water and do as if it dried up. But some days later, it will come back again and try to form back again. Okay, so for the person where they ask about swelling for the inner region.
Okay. Yeah, it's making maybe now boy actually be so yeah, it can take that form, it can burst and come back again. So you need to take some medications which your doctor will prescribe for you, and maybe they will tell you to change some things where they do. If you change all those things and take the medication very well, then I think the ball will stop.
Thank you. We have a very interesting question here. He says, good evening, doctor. Please, I just have miscarriage last week and my pregnancy was 2 months. And when I asked the doctor in the hospital what could be the root cause of the miscarriage, they just mentioned many things that can cause miscarriage in early pregnancy, but didn't tell me the exact cause of mine. So, doctor, please, my question is, how can I know the exact cause of my miscarriage among all the causes mentioned to me so I can know how to tackle it?
Okay, a really interesting question. So most of the time when you ask your doctor cause of miscarriage in early pregnancy, that's what they will always do. Because pregnancy is like a misery. This one is something most people you may not understand. Pregnancy is like a misery. Yeah, what we know is that the sperm you enter, the egg you come, they all join together, and later they all form from two small cells. That's to tell you say pregnancy is a mystery. Yeah, that's to tell you say pregnancy is a mystery. So all those things where we tell you, all those things where the doctor tell you, it's not like they are not correct or they are correct. But sometimes they will not be able to pinpoint, as at that point, they may not be able to pinpoint which one really be your own cause. Most of when they don't ask you so many questions and you say no to it. So they may not be able to pinpoint this one might be the particular one. And for that period where you take get that miscarriage, which is like 8 weeks, that is 8 weeks, and it's within the first trimester. Most of the time, early pregnancy miscarriage actually happen within that period between 8 to 11 weeks. Yeah, and that any miscarriage will happen within that period most of the time are almost hormonal problem with hormones. Yeah, so sometimes if you can't recurrent, they'll contact you, oh, may you go check your hormone, may you go do so many tests and to check. say, "Ah, is this what is wrong with this person's hormone? Why this thing they happen like that?" So most of the time, na hormonal problem, and they really they cause am. So no doctor go fit just tell you say that this one I be your own cause. So no, I'm not sure say they, except as they ask you some question, you are able to tell them one or two things that they can relate to wetin fit cause miscarriage. Or maybe you tell them say you get malaria, you not go treat am. They'll say, okay, maybe now the malaria cause your miscarriage. Or they tell you tell them say, you get infection, discharge, this and that, you not do anything about and you think say na normal. Yes, they feel they look as okay, maybe now that one I cause am. Or you just say, I did a very strong activities that period. Then the next day I started to notice stomach pain and this is started to come up from my body. Then they go want attribute am to that stressful activities when you do. So now based on wetin you tell them, based on the way you take answer their question, now they go fit take pinpoint say na this one be the particular one. If all the answer wey you give them based on the question wey they ask you are not significant, does not bring anything, so they will not be able, they'll just to list all those causes of miscarriage for you. And one of them, which is the hormonal, I still talk about the hormonal hormones. That's some medications too. I mean, sometimes they'll tell you, say, not they take any medication, not be everything you must drink when you get belle. Yeah, some medication, some kind of food you eat, some kind of drink you take, all those things can actually cause miscarriage in early pregnancy. So those are things you need to check. You need to check and see. Yeah, Dr. Fred.
Yeah, thank you very much. If you are just coming, we do question and answer. If you never share this live session, share, because I see that some of us never share. This person don't share the live session. Make we answer her, I beg. We have a question here. Gladys says, "Good evening, please. What is the cause of ovarian cysts? What's the cause of ovarian cysts?" I could just talk few and then make I swear that Dr. Israel go add one or two. Ovarian cysts, they broad. They broad. We get the one where they occur like they normal, they call them functional. They occur for most women, they common. What thing they happen, we say natural from their period. Get some as woman go, they see her menstrual cycle, she feel develop cyst. So we get different types. The common one the follicular cyst, many women. We get some other ones which today corpus luteum cyst, some other ones, and we get the one will be pathologic cyst. So if you say you get ovarian cyst right now, the most important thing to find out from you, where you go ask your doctor now, what type of ovarian cyst do I have? Do I have the functional, the ovarian cyst, the physiologic cyst, or not the pathologic cyst I get? Okay, if not the functional, the physiologic, it can disappear. It can go on its own. You don't need any big deal. If not the other type of ovarian cyst, then they will can't tell you what they go do to take help you manage. But just saying I have ovarian cyst is like a broad statement. And this is why you need to see a doctor quick. May they help you, or see an obstetrician, a gynecologist. See a gynae, may check you and find out what thing they happen and how they go take help you manage them, because ovarian cyst they big well and they common, and the ones where they common now mostly the functional or the physiologic ovarian cyst. Dr. Israel, are you there? Okay, let's see. Okay, let me see. Good evening, please. Can lack of knacking cause testicular pain? I beg, help us respond. I beg.
Well, I don't know. I want to answer this question though. Okay. Testicular pain. Two things when it cause testicular pain. Now, one, torsion. When you get torsion, that's what we call torsion. Where we say the rope when all the testicles can't twist, so blood not on the enter the testicle way where it cause testicular pain. Infection for that side, still cause pain. Trauma to that place, still cause pain. Yeah, these are some of the things when it cause pain to the testes. So knacking not be it's not really a cause of pain to the testes, because if you say knacking, what about those who never even knack at all and they not get pain for their testes? What do you want to talk about that? You want to say that, you understand? So, but in some case, you think, and if you be saying your body full and all that, maybe because you don't deny all those in your body full, you just dey feel unease everywhere in your body. But knacking itself not fit cause, they cause pain for the testes. Dr. Fred.
Yeah, thank you very much. Thank you very, very much. Let's be fast. Share this video. Good evening. What causes frequent stooling? Sometimes watery, sometimes not watery. I've been to the hospital and the doctor just gave me medication, but yet it didn't stop.
Okay, when you get frequent stooling like that, yeah, and watery or not watery, and you first of all, the one thing know now that will be your normal way of going to toilet. If not be that's not your normal way. Sometimes you want to do investigation, want to do tests, want to see which bacteria or virus or fungi or whatever they cause, or parasites they cause that stooling for you. And so when they do investigation, they go know what they cause them. Sometimes if it not be any of those things, if it be functional, if it be saying now your intestine and all that, they get some kind of issue when we say if you eat, they know they like things not they stay. If people be saying that the kind of food when you they eat, now they make you they always they go to toilet every time. Or if you just dey on some medications when still be saying that they cause them. So these are questions when they go ask you, then they will find out what really they cause this your stooling. Then if you don't dey stool for more than 1 month, I beg, one of the tests where you need to do, go and do HIV test. Just go do. I not say you get to, but just go do. Yeah, just go do. If you don't pass 1 month when you did notice this thing, just do it. To be clear, say you know they there. Yeah. So these are some of the things when we give you that those kind of watery stool and all that. Dr. Fred.
Thank you very much. Good evening. Okay. Can watery sperm get woman pregnant so long as its motility is active? Okay, the man's sperm they watery. If he give woman belle, that is your question.
Okay. The answer to that question is what is your definition of watery sperm? Sperm they watery. Sperm not be actually be I don't know how to tell. It not really be like thick akamu. When you say nah, this is an akamu, sperm is watery. So it not depend on the cells, the spermatozoa, the cells for inside, how functional they are. Now that one they determine whether woman will fit get belle or not. Not whether the sperm they liquid in form or whether they very thick in form. That's not the reason, the main reason. The main one is how functional the cells is. If the cells are very functional, the cells are good, yes, you can impregnate a woman.
Thank you very much. We get people on YouTube, but I know they see YouTube people comment here. So for you where they YouTube, I beg, drop your comments so that we go fit respond to you. Now our Facebook people they ask, but for YouTubers, if you watch me on YouTube right now, drop your questions. I want to be looking for all your questions and answer you, because we don't answer Facebook people well. Now somebody's asking the question here. Says, Doctor, did you delete your video when you talk about how to give birth to a male child? I searched for it yesterday on your Facebook, but I couldn't. I wanted to play for my wife, and how can a woman calculate her ovulation? So it's very difficult to search for video on Facebook. It's easier for you to see it on my YouTube. So if you want to see them for my YouTube, This is what you will do. Go to my YouTube. This is the YouTube name. See the YouTube name here. See. This is my YouTube here. You see, so when you go to YouTube, come down. I'm showing you the video now. When you come down, see the video here. How to conceive. You see, for YouTube. It's easy. So all the people where they follow me, we won't find my videos. It's easier for you to see them on YouTube than Facebook, because Facebook you go lost for there. Calculate your ovulation. See, this one, 28 minutes. I need a baby boy and the rest. So please go to YouTube and watch the video. This is the name for YouTube. Yeah, you understand? I had to do it for you because those videos are very important and many women don't watch them and they are very, very grateful. So it will help you. Yes. Okay, let's continue. Somebody says, good evening, please. I'm feeling pain on the sole of my right foot. What is the cause?
Okay, I the many things they cause pain for person body or any part of the body, whether right foot or left foot. Or many things can cause pain to you. Can even be a referred pain, maybe pain for other part of body. You go there. Another thing is that they want to try to know what kind of pain. How is the pain like? Is the pain pepperish? Is the pain hot? Is stabbing? Is it just like blood not in that part of your body? So they want to find out all those things. So those are what you go feel make person know. Say, oh, this one either the right cause of this person pain or not. Sometimes the shoe when you do wear can even make your leg pain you, and if the shoe is too tight, it fit cause those kind of pain. If the kind of work where you do, you stand for one place for a long time, it fit cause those kind of pain. Yeah, if you even they sit down from one place for a very long time, they move your leg all the time. If it even cause pain for you at one point in time. Yeah, and also if maybe maybe you get some kind of like diabetes before, the fit go cause some tingly pain for your leg. Maybe say if you not check your leg very well, if you get ulcer, and then that will come lead to one problem or the other. So you can see say there's so many things if it cause pain for your leg. Now for you to go hospital, make them look the leg very well. And sometimes if you see get pain issue with your bones of the leg, it can also cause pain there. Now for them to look at it very well and know what is really causing your own pain, then they'll be able to sort it out.
Okay, let's be fast. We get comment from YouTube. Please, my manhood don't stand in morning time. What could be the cause? My manhood don't stand. So when you say your manhood no stand in the morning time, your manhood they stand at all. Because not be saying that every morning time the manhood they stand. I know people don't make videos say if your manhood no stand in the morning, there's a problem. Sometimes not be saying you must stand every morning. But so what do you go find for us? We say, is it that they stand at all, whether morning, afternoon, or night, whether when you meet your partner, they stand at all, or they stand. Sometimes in the morning they stand, sometimes they stand. You have to be very clear, because I know people don't do video, don't tell you say one way to know whether your manhood they work. Now, if he stand in the morning, sometimes it's not true for everybody. And it doesn't mean that you have a problem. So you have to be clear and make us understand. Is it that they stand at all in the morning, in the afternoon, in the night, when you're with your partner? Those things are very important information. Let me go to YouTube. Doctor, what's causing constant headaches and back pain? The very common cause of constant headaches, the very common cause, most times, and stress. I'm using the word common. However, if you get headache and back pain, again, it might be stress. But some people don't get headache. They go think say na stress. They go sit down for house. They try to rest, not knowing that something else is actually going on with them. So if you get constant headaches, you get back pain, general advice: give your body some break. Give your body rest and see whether all these things go disappear. But if you have done all this and you see they get headache, continuous headaches, then you need to see doctor. Make them check you, because we know they use headache play anymore. If you just be like saying an ordinary headache, but that headache cannot be ordinary or might not be ordinary. Forget the fact that you have back pain. The back pain might just be something else added to it. But that headache, Phoebe said the headache, even from the brain, connect to the spinal cord. And remember, the back is a link to the head, the spinal cord and the head, the brain. So we need to be very careful. This is why you have to see a doctor. Dr. Israel, there's a comment here. It says, somebody that is positive, can the person be taking his I think antiretroviral at a particular time, like 6 a.m. to 6:30 within the time, or he should stick to a particular time? I want to believe you understand this question.
Yes, I do. So for that person, we always say stick to a particular time. That's what we normally say. We say stick to a particular time. So if it's 6 a.m., you said you are taking it, take it 6 a.m. So we'll now advise a set alarm, so that at least once the alarm ring, you go know what you want to do. But we know say there are even sometimes you go set alarm and that alarm go ring, you no go even remember say the alarm ring. So there's always a room. In medicine, there's never a it must be this, it must be this. It's always a room. They always give you ranges. It's okay. No problem if you take it by this kind of time, it's not still bad. So that's 6 to 6:30. If you take it, it's not really bad. But just try to stick to your time. Then if maybe you can't forget your time, what I normally say, if maybe you forget your time, whenever you remember, take it. Then the following day, go back to your specific time when you choose. So the one thing we go first help you not to forget your time, not to set alarm. Once you set alarm, once it ring, you know what you want to do, you go do one, and that's it.
Thank you. We have many questions. People are not even sharing. Doctor, thank you for your answer. But please, I just want to know if there is anything I can do before getting pregnant again to avoid having miscarriage, because it's a horrible experience and I'm still hot till now. Please help.
Okay. The only thing you need to do before getting pregnant again is I can say this medication, just the use of folic acid. Use your folic acid very well. Eat your normal diet. Try to avoid things that can be that are not too healthy for consumption, e.g., alcohol. Try to avoid all those things. Then meet your man. Because now that will bring the pregnancy. Meet your man. Then once you notice that you are pregnant, start antenatal on time. Not wait till so time. Start antenatal on time. I know there are some hospitals that will tell you that, oh, your pregnancy is too early. No, I agree. Look for the one that will really want to accept you, knowing your waiting happened to you before. Just start antenatal on time, and that will really help.
Stella says, please respond. Stella, on YouTube, we not see your comments on YouTube. I not see your question. I have a lot of people watching me right now on YouTube, and I want to read your questions more, because now YouTube, they really make us appreciate being on internet. Let me see if I can take one more question on YouTube. When you go to the hospital for treatment and the doctor asks how you are feeling and then prescribe drugs for you without proper tests, what do you mean by proper tests? Is it advised to go that same hospital again when the sickness is there? What do you mean by without proper tests? Did they do tests or not? Why do you feel that they did not do proper tests? And yes, if the sickness is still there, what you have to do is to go back to that same hospital and let them know this medicine may not give me. This condition is still there. Do you mind if we do some more investigation? It's not going to good. Make you use this hospital and then you go to another one. Those ones might be starting afresh. Now, even if they want to refer you to another hospital, it's important that they write a letter of all the things that they have done for you. They will write them for that letter, give you to go to another hospital. Because if you go another one, they will start afresh. So yes, you have to go back and let them know that this thing is still there. Can we do this and do this and do this? So my own question to you is, how you take note say they don't even do proper test? Because maybe waiting you they think say be the proper test, not be him, be the proper tests. Let me see. Let me see, my God. They just ask questions without running any test to be sure. And no problem. Go back. Betty, I see you. Betty, yes. Go back again and explain to them. And this time, ask them if there is a need to do tests, since you have been treated before and the thing not go. You understand? That discussion, you and your doctor. No need to panic. We are almost out of time. Let's take one more on YouTube. Let me see. Please, sir, can gallbladder stone cause too little swelling in the legs? I did tests for my liver and kidney and everything was good. And can it also stop menstrual period? Dr. Israel, I beg, help me respond, I beg.
Gallbladder stone causes too little swelling in the legs. Gallbladder, where gallbladder they close to the liver, so it's not near the leg. So I don't see any interaction between the gallbladder and the stone swelling for your leg. Yeah, I don't see any interaction. Then also, the kidney and the liver test when you do, yeah, and kidney or liver, kidney and liver you talk.
Yeah.
Yeah, kidney and liver. Those ones nothing make you stop to see your menses. Yeah, they nothing stop you to see your menses, except maybe they cannot. Except maybe you can't. You are paid to that extent. Say blood not to do your body again. However, enough go fit stop you to see your menses. Your menses will still be seen. Except maybe you have some other stressful activities or stressful issues within this period. No, those one feel even be the one when cause that. But just kidney, no, they not go fit to that one.
Okay, thank you very much. Let me
Dr. Fred.
Betsy. Yeah. Betty, thank you. I see your comments. I see what you sent to support this live session. Thank you very much. I see them. Thank you. Most times now they support this live session pass. And God bless you. We appreciate. Okay, let's take one more question. We are almost out of time. Let's see if this person is still here. Let me see. Oh my God, who be this one? Okay, my 11-year-old child has been delayed in talking. Is it talking up till now? She's not talking fluently. I live in Europe. I have done so many tests. Still, it's not okay. That is why I wanted to hear from you. Oh, okay. Now you ask about the autism stuff, Abby. I don't know. Really. Dr. Israel, do you have anything to say about this?
Well, there are some speech therapies. Yeah, most of the time, and those speech therapies, I go fit do anything. And one thing you should know is that it's not it's not something that we change overnight. So it's going to take a long period, and now with patience. And in some cases, the person may never gain that the way you want him to talk or the way you want her to talk. the person may not gain it very well, but to some extent, you'll be able to understand what they are saying and every other thing. So the one question, the pikin they talk, at least say you the hear. If yes, enjoy that for the meantime. Enjoy it as it goes, because sometimes you may not be able to get whatever you are really, really looking for. You may not be able to get that in particular. But if what it says people can understand and say, yes, oh, I know what this person is trying to say, oh, I can relate, then I think your child is actually doing well. So please, those are the things I would just want to say on that.
Okay, we have less than 5 minutes. Please, if you are just coming, sorry, we no go fit answer because we get many questions. Today we did do question and answer. Don't forget, this program has been on for the past 6 years, every Sunday by 8 p.m. to 9 p.m. Myself and Dr. Israel, we they come here online every Sunday, 8 p.m. to 9 p.m. So maybe today we start. No come late. And this is the least we can do to guide, to advise you. Here no be hospital. We are not doing this because we define patients. We are not doing this for anybody to like us. We're just doing this as little as we can to give and to guide you, full stop. You can share, you can invite your friends, and you can support this live session. Yes, you can support. Thank you very much. Let's take one more question as we round up. One more question. Let me see. God, I define questions. What is the solution to reduce painful menstruation, leading to the lady not going out for 2 days?
Okay, now I want to talk about painful menstruation. For some people, it's a normal thing, while for some people, is abnormal. Yeah. In fact, most cases, pains like that for most people is abnormal. So they need to go to the hospital. They need to see their doctor. I know of someone that can have pain and other things, but after that period, after one day, by the second day, he don't get up. He don't they do a normal activity like say nothing do one before. You don't understand? So because of that, if the person cannot leave the house for like 2 days, staying indoor, having abdominal pain, he needs to, if that's how it has been ever since the person know himself, can't reach by this time, the person needs to go hospital and let them run some hormonal investigation for her, do some other investigation, check the womb and all that, to see if there's anything. But if there's nothing, if there's not find anything, you know, say for that person, that's so it will be. That's so it be. Maybe after I don't born, the thing fee reduce. Nobody can tell. Okay. Dr. Fred.
Oh, yeah, thank you very much. Mr. Joseph, I see your question. Please go to my YouTube. I made a video about your question. No vex. We have to go now. I see your question, Mr. Joseph Udo. Abi Udo. Please go to my YouTube. For those who don't know, this is my YouTube. Here, see go to my YouTube and look for the video. It's on my YouTube. Just scroll down. You go see the video. I don't do many video, and it's easier for you to find on YouTube. I've made a video on splenomegaly. So these are so many videos where I post. And these not all the videos, but these ones get most of the things where you define. Yeah. So it will help you. Please go there and watch it. Dr. Israel, any final comments as we round up tonight?
Okay. A final comment remain. Thank you so much, Dr. Fred. First of all, I would say thank you. Now, every other persons when they watch us, I want to say a very big thank you for you to join us, for you to always be with us here every Sunday. Is a wonderful thing. It's a wonderful thing, and I hope we are able to to put more light on whatever issues you've raised. And I hope we'll be able to help you also to make the right decision and the correct decision concerning your health. I beg, nobody should take his health to play. Oh. This health and this life is sweet. No matter what you think, the life is sweet. So enjoy it because so enjoy it as it is now. So enjoy it, please. Thank you and good night.
Yeah, thank you so much, Dr. Israel. I appreciate you so much for all your support, and thank you for watching. No vex if we no answer your questions. We have to go now. We'll see you next week Sunday, same time on this platform. Share, invite your friends. Like I always tell you, good life now waiting. Good life. Now saying so. Have a great day. Bye bye.